The live button. Yes. Okay.
I do. I hit it. And we're live. Hello, hello. Welcome, everyone. Happy Thursday. My name's Ruby. I'm the director of the Feed Real Institute here with my lovely colleague, Kay Stewart, our course instructor and head of nutrition. And we have a special guest today, Dr. Laurie McCauley. Welcome, Dr. Laurie. Thanks for being with us.
Thank you so much for having me. It's great to be here.
Wonderful. You are joining from North Carolina, right?
I am.
And Kay, as you guys know, is in Tennessee. I don't miss that East Coast humidity at all, but I'm sure it is beautiful where you guys live.
It's starting to get humid, though.
I know it. I know it. Dr. Laurie is joining us today. We're going to be talking about fascia, which I think is a term that a lot of people, probably like me, think when you're reading it, it sounds a certain way. And then when it comes out, you're like, am I saying that right? But I think you guys all know, hopefully, what it is. And if not, Dr. Laurie is going to be expanding on that and talking about whether or not your dog is stiff, perhaps suffering from arthritis or what we think, and things that we can do at home potentially to address their fascia. Dr. Laurie, you are also going to be teaching a live workshop at this year's Feed Real Summit.
I'm so excited.
Yes, and with the use of tuning forks, which is just mind-blowing. Do you have one in front of you that you're going to show us?
I do.
That's so cool.
Yes, yes. So we'll talk a little bit more about that on our live. I do want to just remind everyone sort of our format. It's been a while since we've been on. We took a couple weeks off, but we're going to be asking Dr. Laurie some questions about what she does and have her teach us about fascia and how potentially to address some issues. And we're going to open it up for a Q&A after about 30 or 40 minutes. So if you guys are able to join us for the whole live, we will gladly answer your questions as we're going on. If you have to step away, please post your questions in the comments and we'll get to them and you can watch the replay a little bit later. Awesome. Before we start, would love to know where everybody is joining from, and I will give Dr. Laurie a lovely introduction with this bio that I got. Dr. Laurie McCauley has dedicated her life to helping pets live their happiest, healthiest, and most mobile lives. After graduating Colorado State University's School of Veterinary Medicine, Dr. Laurie spent years in general practice before pioneering the field of veterinary rehabilitation. She designed the first ever underwater treadmill for dogs and opened up one of the first rehab clinics for pets. That is amazing. I didn't know that.
Oh, yeah. Actually, you know how they have tanks now?
Yeah.
The first one was 10 inches of cement all the way around.
Wow.
I worked with a zoo. We had aquarium glass. We had a home security camera that was hooked up to a monitor. And then the underwater treadmill itself was on a jet ski lift. And I learned that from cranking it so much.
Wow.
Also tendonitis. So when we built our new building, we put in boat lifts so it could hold 3,000 pounds and go down. And it was 4.5 feet deep. So we could stand and the water was up to here. And then we could work with the dog's legs. It was awesome.
Wow, that is amazing. So it was designed specifically for canines, but you had to work with the zoo.
No. The treadmill was a human treadmill. There was no such thing.
Right.
So I took a human treadmill, put it on, had somebody weld it onto a base that we put onto a jet ski lift so that we could take it down into the water. And then I had jets coming in at 3 different levels. So for small, medium, or large dogs, or a little bit or a lot of resistance, because the air significantly increases the resistance. And then the faster you go through water, the more resistance. So we could take everything from a paralyzed dog and get them walking again to an athlete and tire them out in like 5 or 6 minutes. It was great.
Amazing. That is amazing. Wow. Oh, so cool. Like I have so many questions about how many times you iterated that treadmill and like how it evolved, because now we see them quite frequently in a lot of rehab centers. Oh, would love to pick your brain about that later. But yes, so she designed the first underwater treadmill for dogs, opened one of the first rehab clinics for pets, and has traveled the world since then, teaching thousands of veterinarians and pet parents. on the transformative power of rehab, acupuncture, chiropractic therapy, and sports medicine. That must be what all the letters after your name.
That's right.
Yep.
Yes. Well, welcome, Dr. Laurie. We're very, very excited to have you on today's live to talk about what you love and are an expert in.
Yes, I love fascia. It's just mind blowing what we can do with the tools, everything from our hands to things like the tuning fork or the other tools to help our pets or patients be just so much happier.
Yeah, absolutely. Well, before we dive into what fascia is and all of that, can you just share a quick story of how you went from general practice into rehab? Was there, a light bulb moment, or was it after seeing so many clients with the same issues?
So it started out, you graduate vet school and you're like, oh my God, this is amazing, right? And you know the tip of the iceberg, right? Because they can only teach you so much in that many years. And then it was like, oh, every day, every case was cool. And then it was like one case a week was cool. And then it was one case a month was cool. And then I kind of got bored. I hate to say it, but it's like another dog with diarrhea, another cat that's vomiting, another spay, another neuter. And I had this like burning desire to learn acupuncture. Like I would dream about it, right? It was like, to me, God driven, like this is what you need to do. And I went to my boss and I said, I want to learn acupuncture. And he said, I don't believe in it. I won't give you the time off to learn it. If you do it, I won't refer to you. And it was like total line in the sand.
Mm-hmm.
And then I fell down the stairs at 3 o'clock in the morning, putting my dogs out. And I went to hurt my back, went to the chiropractor, and he couldn't fix me. He sent me to a surgeon who sent me to a physical therapist. And I went, oh my God, this is so cool. So this is why like the chiropractors do this stuff, but then you have to keep going back. You have to strengthen the muscles. You have to figure out what's going on and you balance the body. And I'm like, I'm going to take that course too. So I'm like, okay. So I called up, I don't know if you guys are old enough to remember Emergency Vets. It was like one of the first Animal Planet shows. So that was in Alameda East. And Dr. Rob Taylor owned that place. And I called him up. He had a physical therapist who was teaching the vet techs some like how to use an Easton machine and things like that as they were going through their training. And I said, can I come to you and do some just research with you, see what you're doing, learn. So my life happens always for a reason. It's very driven. So he says to me, I don't usually allow interns, but I have a really strong feeling that we should do this. So I came and I spent 2 months there. I had a 6-month-old son. There was no way I could have left my son, except that as things happen, his clinic was 5 minutes away from my mom in Colorado.
Oh my gosh.
Right? This is how my life worked.
Wow.
So we went, we did research together. I read every single physical therapy book I could get my hands on, talked to human physical therapists, work with them, came back, designed the first underwater treadmill, started this, was going to be, I had a 6-month-old son. You understand that? I was 2 days a week, 6 hours a day. That was it. And within a year, I was working 60 hours a week. And then I was working 6 days a week. And then I started hiring people. And then University of Oregon in Corvallis at the vet school, they had the first sports medicine and rehabilitation conference ever. It was an international conference. And I went and I presented information about the underwater treadmill thinking, okay, this is going to be cool. And I had multiple people ask if I would teach a certification course. So I went with CRI. So I was on their faculty, was one of their main instructors for 14 years. I ended up having interns from all over the world. I think it was like 17 different countries. It was, and my personality is I'm like, you know what? I want to teach you so much. And you're coming from Italy or Brazil. Come stay at my house. So even when we're talking, I can be teaching you stuff, right? To be 100% honest, they taught me as much as I taught them, right? Because we all learn from our own experience.
Of course.
And it is such a blessing to be able to help people help dogs. I always tell people, like my clients are like, Laurie, you're going out of town again? And I'm like, if I work one day, I can work on up to 10 dogs. For every 10 people I teach, that's 100 dogs a day. And that's my life goal, right? Is help as many people, help as many dogs around the world. So I guess that was really a long answer to, I was never bored again. Every patient I see is exciting. I love watching them melt. I continue to go to CE to continue education, to learn everything I can. And give you an instance, 2.5 years ago now, I was hiking up in the mountains thank God I had a friend and my dog, and I fell and I broke my fibula. Now, thank God I had my walking sticks with me, because she took my pack and my dog, and we hiked 1.5 miles back to the car. And as we're going back, I'm like, all right, God, you gave this to me. Obviously, this is going to teach me something that I need for the dogs. What are you teaching me, Lord? What are you teaching me? And I can't tell you how much I learned on bone healing and the periosteum and osteopathy and lymphatics and from my own thing. And and now I can teach that, right? It helps the dogs.
Yeah. There's nothing like going through your own personal experience.
Yeah.
Well, thank you for sharing that story. No, I think, we've had a lot of different veterinarians on our show, and everyone has their own sort of journey to get to a more holistic and integrative path. And it's always really nice to hear each individual's story. So let's sort of start, let's sort of start from the basics. Can you explain what fascia is? Why is it so important for our pets' health?
Absolutely. So the first thing is, most people have made a Thanksgiving turkey or cooked turkey at some point. So if you make a turkey, you either peel the skin off, or you may take some butter and herbs and push your hand between the skin and the muscle.
Yep.
What you're doing there is breaking up those restrictions in there that you're feeling. That's soft fascia. So fascia is the stuff that connects things, right? Is a way to explain it. It's if you it wraps around every blood vessel, every lymphatic duct, every nerve. So if it gets thick and icky, so it can get thick and icky for multiple reasons, but then it contracts around those. It allows fluid to go through the tissue. It allows electrical currents to go through the tissue. So when it gets what I call sticky icky, things don't move. So like, there's studies that show that if you can free up the fascia in a cancer patient, you actually have less metastasis, because you're letting that fluid flow to go through the lymphatics, to go through the liver, to let the immune system take care of it and get rid of it. So literally, there was a study in rats. And again, I jump back and forth between the pet parent and the research, because I'm a research nerd. That mice that had tumors that were stretched, so they just did like little rat yoga, had less metastasis. Only chicken, right? So you can get thickened. Well, let me back up. Sorry, I get so excited. So if you've ever had like a steak or chicken and you see that shiny stuff on it, that's dense fascia. So fascia goes around every cell in the body, including, they have electron microscopy. So like looking at like things blown up really big, it goes into the nucleus of every cell.
Wow.
Right. So, and it's one layer, right? So it is attached. So remember when you were a kid and you're like, the knee bone's connected to the hip bone? It's true. And there's tracks of fascia that go through the body, some that come this way, some that come this way, some that zigzag up the body. And if one line gets tight, it can literally take a person and make them do this, right? As it tightens up.
What's the difference between fascia and ligaments?
So fascia goes around the ligaments. So ligament, by definition, is something that's connecting a muscle to a bone. The difference between a ligament and a tendon is I'm sorry, I messed it up on you. A tendon goes from muscle to bone. A ligament goes from bone to bone. Another word to think with that is a sprain versus a strain. So you remember, you sprain your ankle and there's very little muscle down there. So that is a ligament. So you're tearing pieces of a ligament, as compared to a strain where you're tearing muscle or tendon.
Got it.
So is fascia synonymous with connective tissue, or is it a type of connective tissue?
So connective tissue includes fascia.
Okay.
Right? So fascia is connective tissue. It's connecting everything. Would you say it's synonymous? It might be like a layman's term versus
Okay.
connective tissue versus fascia.
That's what I was wondering, because we all, I think, have heard of the term connective tissue, and yeah.
Yep. Yeah, and if you've heard the term interstitial tissue,
Mm-hmm.
that's fascia too. So that
Okay.
is literally everything besides the cells,
Wow.
right?
Got it. So how do we know if our dogs are suffering from some sort of fascial issue? I mean, are there signs? Are there certain ages? Like, what are we looking for?
So if we're looking for it, it could be a trigger point, right? And fascia has 10 times more nerve endings than muscle.
Hmm.
So we can work hard on the muscle, or we can work light on the fascia and to get that muscle trigger point or not to release. It can be stiffening. Like if you get up and you're stiff, that's from your fascia. And you can have fascial restrictions from age, from inactivity, from stress, from inflammation, from trauma. So there's all kinds of things. I would actually, okay, here, let's play. I want everyone to take their left hand and put it on their right shoulder and put pressure on your traps right in here. And you're going to find an area that's kind of sore. And you're like, ooh, and it's kind of like a ball, kind of hard. That is a trigger point, and that is related to your fascia. So can we fix it just for fun?
Yeah.
Yes.
Okay. So I want everybody, we're going to put some pressure so you can feel it. And we're going to take a big inhale. And then as you exhale, you're going to put a little more pressure on it. And then we're going to do that same thing again. Ready? We're going to inhale. And then put more pressure as you exhale. Now feel it. Is it less tender, less hard?
My neck actually popped.
Yeah. That's a technique called ischemic compression. So ischemia is you're literally pushing the blood out of the tissue.
Mm-hmm.
And then as it comes back, it releases the Golgi tendon organs, which are little receptors in the muscle to make them flip. So it gets rid of the trigger point.
Wow.
Now, it's a little uncomfortable, and there's other ways you can get rid of trigger points, and that may have decreased it. It may have gotten rid of it. Like on mine, I'm like, well, I got rid of about 50% of it.
Mm-hmm.
There's other techniques that we can use. We can use laser. We can use a tuning fork. We can use massage. There's all different ways to get rid of it, but that's an easy thing that people can feel the difference.
Mm-hmm.
So it's a nice one to teach.
Yes.
How does that translate to working with a dog, though, right? We can verbalize, oh, yeah, it's about 50% better. But, you know, are you seeing a visual relief when you work on these trigger points?
Can you see Sid up here?
Yeah.
So
Yes.
I can take Sid and I can say, okay, so here's his back toes, here's his hock, here's his knee, here's his hip. I know he's black and it's hard to see, but every dog, every breed, if their back is straight, should be able to, I'm going to hold his pelvis, bring his toes to his elbow, or at least like if it's a dachshund or a corgi, point to him. Can you see how he's stretching all the way out forward?
Mm-hmm.
One of the most common places we see trigger points is in the gracilis muscle on the inside of the thigh. Many pets can't do that. That's probably one of the most common trigger points I see. And if you're stretching it and they can't go, if you put your hand on the muscle, you can say, oh, wow, look at that hard ball, right? That round, hard point. That's the trigger point.
Wow.
So you can learn where the trigger points are, how to find them, and then fix them.
Huh.
And the dogs totally melt, right? So imagine if you've gone to a massage therapist and they're like, oh, you're really stiff here, blah, 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 blah.
Mm-hmm.
And then you're like, oh, you may fall asleep, you may relax. It's the same thing with the dogs.
Awesome. I am now even more super excited for your workshop. I'm going to have to figure out a way to just, leave the rest of our students at the conference and duck into your workshop. I do want to add for everyone that's listening in right now, we are aiming to get all of our workshops and the entire Feed Real Summit Conference race approved for continuing education. So if you are a veterinary professional listening in, or if you are a dog parent who wants to tell your veterinary professional staff that we have this conference that is race approved for CEs, please encourage them to come, because this is going to be a workshop and an entire conference that you guys don't want to miss. Very, very cool. Okay, so awesome. Trigger points. I do imagine that you can see that immediate relief, and not just right. And if they're able to have a certain mobility or movement that they didn't have before, that's the truth is very obvious there.
Can I tell you some of what I saw just this past couple days?
Yes, please.
All right. So here I am at a conference, and one of the vendors has his dog, and the dog's tail is down. He has had her anal glands expressed every 3 weeks for years. The dog is very sore. And Peter Tobias saw the dog and he said, well, the pelvis is sore. Have Dr. Laurie take a look at it. And in about 20 minutes, the dog's tail is up and wagging. The owner was like, oh my God, what did you do? Right? And all I did was I got rid of the fascial restrictions. Her pelvis was twisted. So if somebody said, what did you do? I could say I did chiropractic. Did I really? No. Right? Because I didn't put any hard thrusts in. I haven't done that in a long time. Not that it's not great. Just in my hands, I have found other techniques that work really well. But just doing that, the dog was much better. I had a lady who was in a tennis accident. And let's see if you can see. She said 20 years ago, she could only extend to here. And now she could get to here. And I think I worked on her for 5 to 10 minutes and she got to here. Wow. I had a lady that had arthritis in her hand, right? And she's like, yeah, I have a lot of restrictions. Again, 5 to 10 minutes with the tuning fork. And she's like, oh my God, it's been so long. We had a lady who had scar tissue here where she had surgery. She had something removed and it was thick and uncomfortable. She would do this and it would stretch and pull. And in a few minutes, the scar tissue was flat. No pull. There's crazy things we can do with scar tissue and fascia to make life significantly more comfortable.
Awesome. Well, what are some common signs that we might see of fascial issues or pain in our dogs?
I think about going up the stairs or down the stairs, right? If you think about, I want to go upstairs, mom went upstairs, but I know it's going to hurt, right? Or I want to go downstairs. Maybe I'll sit up here and wait, or I can't jump in the car or on the bed, right? If I get up a little bit slowly, or I take 1 or 2 ouchy steps and then I'm okay, that's usually a soft tissue issue. I'm just not as active, right? I used to be able to go for 5-mile walks, and now I get like a half a mile and I want to go home.
Yeah, that makes me think of something. I mean, you're obviously a huge proponent of physical activity and mobility, but I think, in our line of work, we've seen kind of 2 extremes: a couch potato versus a fitness fanatic, right?
Right.
Which of the 2 is worse for fascial health?
Oh my God, inactivity, right? To stretching and strengthening is longevity. It is health span. So I am like I said, a research nerd, and I don't know if you know Peter Attia, The Drive. I listen to every single podcast he has. It's amazing. He's a Stanford doctor, and it's all human stuff, but we transpose stuff. And he has pulled research that shows that you need 3 kinds of exercise to significantly increase longevity in humans. You need balance and proprioception, right? So that would be like dancing or yoga, tai chi, anything like that. You need endurance, right? Because that's your type 1 muscle fibers, that's your posture. And then you need strength training. So that's why I have Core and More, right? Because I wanted to incorporate all of that to be able to increase health span. So lifespan is how long you live. Health span is how long you're healthy. right? So no one wants to live to 150, but only be healthy until they're 50.
Yeah.
That's right. Are there some things that we might be able to do at home? Say we do notice our dog having trouble going up those stairs or taking, a little bit longer than we'd like.
Absolutely. So, oh my gosh. So stretching, right? So, I'm going to throw in a plug for, God, I have it in multiple courses. Like in Core and More, we teach stretching and cookie stretches, right? So you can see it's a great way to check for the dog. In horses, they call it carrot stretches. You take a cookie and you take it to the dog's shoulder, and then you go down to the hip and then down behind the back leg. You do the same on the other side. And if your dog can do it, they at least have the ability to laterally stretch, to go down behind the toe. It's rotate. We do straight flexion. We do extension. And we can also tell if they have a restriction. If they look at the cookie, but they can't get there, that means they can't get there. There's a restriction. If they go to the cookie and turn back, that means they're painful. They're painful. Right? So that's a diagnostic tool.
That course is called Core and More?
Core and More foundational exercises for your dog.
Nice.
And so that's for pet parents.
That is for pet parents, right? The version that has more information and is for the professionals is Optimum Geriatric Exercises. But it's 24 exercises in a progression, so you can't cheat and go to the end. And it teaches not just how to do the exercises, but when to do them, when not to do them. So what the contraindications are, the red flags. Oh my God, if my dog does blank while I'm doing it, I need to stop or stop and go to the vet. Biomechanics for the person, because I don't want them to hurt themselves while trying to help their dog. When to end. This is so easy for them. Now we need to progress to this one. And just lots and lots of info. Oh, and how the dogs cheat, right? I've been doing this for almost 30 years. I started rehab in 98, so a very long time. And how the dogs cheat and how to outthink them.
I love that.
Yeah.
So that's a geriatric dog, but should we be doing this with our young dogs?
Yes. So
to keep them from having
right
issues?
now we're in the process of changing the name of that. That will come out sometime at the end of this year, because that's everybody hears that. So I designed the course because when I got Sid, he came to me at 11 months old and he chose me. Now I adore him. He's my heart dog. But I'm like, you have straight shoulders, straight knees, and a long back. I am a rehab mom. You're not going to have a cruciate injury. You're not going to have a back or psoas injury, and you're not going to have a shoulder injury. So I put these exercises together, and then I share them with friends. And one of my friends in Chicago, so we did this long distance, is like, oh my God, Laurie, I thought I had a strong dog. Sophia was 10 when she started the exercises. At 11 and a half, she was the 7th fastest dog in bad dog agility for shelter.
Oh my gosh.
Right. Wow. So everyone else was like 4, 5, and 6. And here's this 11-year-old and in the 7th place.
Wow.
She's like, and I'm like, okay, so I need to put this. She's like, Laurie, you need to make this into a course so more people have this information.
Yeah.
And it has all different challenge levels. So everything is core, right? So it's strengthening the body and the limbs to decrease the chance of injury, right? As well as, so it's your proprioception and balance, it's your strength training, and then all you need to add is your walking, running, or swimming for your endurance. And we even talk about that.
That's
awesome. Nellie has included the link to some of your courses in the comments. So for those of you guys tuning in, make sure you check out Dr. Laurie's page. We're also going to have a special discount that we're offering if you stay through till the end of this live. How many courses do you have?
So we tried to mirror. So most of our courses, we have like a laser course for professionals. That's 20 hours race approved. So it is a lot. I put my whole heart and soul into it.
Sounds
so
like
that anyone who picks up a laser, and that covers not only the joints, but like, oh, my cat has kidney disease. I want to increase perfusion. Oh, I have anal gland issues, ear issues, dental issues, the whole body. And then to me, that's too much for the pet parent. So I created a pet parent course. So there's optimum laser therapy, and then there's at-home laser therapy is for pet parents. And that is simplified.
Mhm.
And it goes through with multiple lasers, how to set the laser, how to position the dog and position the probe. Because believe it or not, I'll show you with my wrist, right? If I had a laser, I'm going to use my tuning fork because it's in my lap, and I'm aiming, because aiming is extremely important. And I do this on my wrist, so you can see.
Mhm.
I have to go through bone to get to cartilage. If I do something as simple as bend my wrist, it takes it from this to this, and I can get the cartilage. And I also stretch the joint capsule, which is where all the cells that make the inflammatory mediators, the problem cells. So by
Mhm.
doing that, I'm getting double duty. I'm decreasing inflammation and I'm getting to the cartilage. So position of the probe and position of the dog or cat is extremely important
Mhm.
for optimum results. Will you get some results if everything's like this? Yes. And you'll get less results if the dog is standing up on it, because then it's compressed.
Mhm.
So there's, again, I've been teaching on laser for 30 years or almost 30 years. So I've learned a lot. And
No, these are great tips. And you're going to be teaching with tuning forks this year. We ought
yes,
to have you back next year to talk about laser.
we should absolutely. Yeah. So we have the laser course, we have the exercise course, we have Fascia 101 for professionals, fascinating fascia for pet parents. And again, they're mirrored. So this is more technical. It goes through things like needling and taping. Both of them have a lot of manual techniques. And there was like 5 minutes in them on the tuning fork. And we had so many people say, I want more, I want more, I want more, that we created Tuning In for Your Dog, which
Nice.
is just, it blows me away, the results we're getting with the tuning fork. Like I said, it's just crazy.
All right, Ruby, I can't teach my workshop because I need to go to hers.
We'll have Laurie, we can have you fly in a day earlier and work with our staff.
Yeah.
That way
We
we can all have
we should.
work with you.
I mean, it truly is amazing. It's so cool, the things that I'm seeing.
Yeah. Yeah. Very cool.
And
I do want to open up the floor for questions here soon, but I have a few more of my own. So we were talking about identifying some of those things that we might see in our dogs. And you said some things to start with might be, at home exercises. You talked about the cookie exercise. What about something as simple as just like massaging their paw, or like, I wouldn't even know where to start.
Okay, cool. Yeah, absolutely. So if you've ever had a hand or foot massage, right, it feels really good. It's really relaxing. So again, let's see if we can bring up Sid's foot. So here's his little toes, right? Here's his metatarsal pad. If I come in here and rub right in front of that, he's pulling away because he's like, "Oh, mom, you're touching my foot."
That's what I'm thinking.
Love this, and it's very relaxing, both front and rear feet. So coming in and massaging in there is really good. There's a technique, a petrissage technique, which means my pressure isn't going down, my pressure is coming up. So I can come and I'll show you here, and then I'll show you on him, but it's, again, he's black, so it's hard to see. If I just do this, right, it's like, oh, okay. If I do circles as I come up, they melt. So I've had dogs where other vets will be like, do not touch without a muzzle. And they come and they sit in my lap.
Aw.
Just rub on them. So on him, it would look like, I don't know if you can see this. I'll do it on his side. Can you see that? And I'm making circles, and my pressure is as I come up. And the dogs love it. And you can do that anywhere. You can do it on their neck, on their back, on their legs.
What about if they have suffered from some sort of injury? I mean, I would imagine there's a certain waiting period while there's healing. But how do I ask this? If we're seeing stiffness as a result of that injury, when is the right time to start working on their fascia? And do we start with something like these simple circular motions in our massages?
That is a great question. So let's think about it logically, right? If you make an incision in 10 days, that incision is 10% healed, right? If you need scar tissue, you want to wait a much longer time than if you don't want scar tissue. So talking to human, because I'm a nerd, talking to human plastic surgeons, they say immediately after surgery, you can gently, so say I had a scar or I had an incision here, right? I can go on either side of the incision immediately. That's increasing blood flow and it'll help it heal faster. I want to wait at least 3 weeks so that it has a chance to heal before I go perpendicular.
Okay.
And 4 weeks before I put much pressure on that. Does that make sense?
Yep.
So now if we take that to the dog and we say, what's the most common surgery we see? Cruciate surgery. If someone has an extra capsular surgery, we require scar tissue because that fishing line that they put in there is going to break sometime between 6 months and 18 months.
Okay.
So you need that scar tissue. If you break up that scar tissue, the dog's unstable again, and you've wasted that time and money and pain and all of that. So you need to wait a good, 8 to 12 months before you break up that excess scar tissue, right? You can do gentle massage. If scar tissue is your goal, you don't want to break up the scar tissue. Now, if you have a TPLO, a TTA, or any of the other ones, you wait until the incision is healed, and then you can break up the rest of the scar tissue.
Makes sense. Can you talk a little bit about how diet affects fascial health? I have 2 questions. I mean, one really about dehydration, I think is where I think is an important place to start. Like, is that chronic dehydration something that you see common in dogs with fascia issues?
Let's flip it the other way. Any kind of dehydration is going to cause fascial issues. Anytime, right? So one of the things we do with the tuning fork when I explain to people how to use it is I activate it and I put it on top of their head, which is an acupuncture point, GB20. It's also the coronal suture. So the place where bones come together and you have the bones that do this rather than fuse, right? So I can tell if they're stressed or dehydrated. Because if they are, they have a fascial restriction above their cranium. So on top of their skull, between the skull and the hair or about the skin, and the tuning fork will vibrate and then stop.
Oh, wow.
Whereas if I put it on their shoulder where they don't have a fascial restriction, it'll vibrate for 20, 30, 40 seconds before it stops. So the tuning fork is a diagnostic tool as well as a therapeutic tool to say, oh, my dog may be stiff in the hips. So I'm going to take the tuning fork, and if I slide it down and there's no restrictions, right? So if I slide it on my hand and there's no restrictions, it slides, my fascia is good. If I put it on my neck and I happen to have a trigger point there, it's going to be like it's sitting in peanut butter. It's just not going to go. It's going to go and stop, and then this will dampen much quicker.
Wow.
It's cool.
So cool. So cool. So what about diet? You know, what's your recommendation?
Healthy, no processed. Right? So I have to, everyone has their own time constraints and financial constraints, right? I would never I would never choose to have my kids fast food, right? There are kibbles out there that are like fast food. My dogs are on raw. And I will tell you, let me tell you that story. I went through vet school, and now granted, I graduated in 1992. Things have changed. The only nutrition course we had was taught by a Hills representative, and it was a pass-fail class. And they said, we've written this book, and we want you to read this book. Now, we're going to grade you on if you edit a chapter in the book for us. If you edit a chapter in the book for us, you pass.
Wow.
If you don't edit a chapter for us, you fail. Whether you read the rest of the book or not is up to you.
Wow.
Right. And then we had the school got free food, and then they made a profit by selling it to us at about half price. So everybody was, Hills must be great because that's what the school recommends. When I started rehab, I had a lot of geriatric dogs, and the dogs that came in at 16, 17, 18, 19, 20 years old, at least 80% of them were on raw. And I said, I need to know more about this. And I've been feeding my dogs raw ever since. Now, everyone has their own time constraints and financial constraints. Right. Some people can't do it, and you find the best you can do for your dog the same way you find the best you can for your kids, right? You don't
Sure.
want to feed them McDonald's and processed sandwich meats and stuff like that. You want fruits and vegetables and good protein sources and all of that. And yes, it makes a huge difference in the fascia.
Yeah, well, absolutely. And just to sort of connect the dots, stating the obvious here, if you are constantly feeding yourself or your dog dry food,
Yeah.
they're more likely to be chronically dehydrated and
Mm-hmm.
suffer from, not just the muscle stiffness and these issues, but all these other health issues that Kay has written hundreds of articles about.
Processed food increases inflammation. And can we take it one step further? White fat, right?
Yeah.
More than 66% of American dogs are either overweight or obese. We have the Purina lifespan study
Yeah.
that looked at, let's take pet weight dogs, so not overweight, just pet weight dogs, and then they split litters, and the other half of the litter got 25% less. So they were lean. Those were our marathon runners. On average, they lived 2 years longer, way less osteoarthritis. And this is feeding a kibble, right?
Right.
Way less metabolic disease, so much healthier. And I always tell people, you have the choice every day you wake up, right? And we have the choice. We can either get smarter or stupider. Am I going to learn something today? Get stronger or weaker, right? And it's the same thing with our dogs. Are we going to walk them? Are we going to do exercises? Are we going to engage their brain? Or are we going to let them sit and hang out and listen to the radio during the day, right?
Yeah.
And again, if you work all day, come home and take your dog for a walk.
Yeah. And then it'd be great for you too. That fresh air, the walk. I mean, it benefits everyone.
I have a client that has poodles that I had a bicep tendon issue. And I said, you need to walk tilt. You need to walk tilt. And she's in a independent living facility. And I'm like, listen, even if you walk him down the hall and back 5 times, right?
Mm-hmm.
I saw her like a month later, and she's like, we're up to walking once a day and my hip doesn't hurt anymore.
Aww.
Within 3 months, she was like, we're up to 3 miles a day and I have no pain and I'm getting my friends to walk with me.
Amazing.
Right? I mean, it's so good for everybody.
Yeah.
Yeah. It's a lifestyle change, but I think hopefully something that we're starting to move forward with. And I will say it's very difficult with technological advances, and what we perceive as connectivity through the internet, I think is really, in many ways, forcing us to be a little more disconnected from each other, because we're not getting out and about and doing those things together.
Right. How else do you meet your neighbors, right? It's when you're out walking, you're gardening, and if everybody's inside their house. I heard a comment the other day. They said the worst thing that happened for civilization was automatic garage door openers.
Yeah.
Just open it up, drive in, and you never talk to anybody.
Yeah, 100%. So this has just been sitting in my head since you mentioned it. Have you visited your alma mater, Colorado State? Are they still sponsored by Hills and giving out free food and only have one nutrition course in the?
I'm sure they have more. But there are less than 100 board certified veterinarians in nutrition in the world. Right?
Yeah.
Yep.
You don't have to tell Kay. She's trying to reach every single one of them.
I contacted all of them because to get our course race approved, I'm not board certified. So I had to be approved, and not one of them would cooperate with us. So I actually went out into the PhD world and found nutritionists that supported me. So yes, I'm well aware of how many there are.
Yeah.
Do you recall which chapter you edited?
Oh no, I graduated in 92. That was a and it wasn't even our senior year. I think it was like our sophomore year, it was our sophomore year.
Yeah.
Yeah. So I went to vet tech school at Purdue, and I graduated in the early 80s. And Purina was their sponsoring school. Yeah.
I mean, it's great marketing for them, right?
Absolutely. Well, and what's funny is I tried to do an article about it, and they've got it very well hidden now. in the veterinary schools. It's not,
Oh,
I mean, it
sure.
used to be like proudly sponsored by, you know,
Right.
and now they've realized that that's not the way to go. So you really have to dig deep to see who sponsors whom. But
Well, and like I said, I know a lot of the schools have someone who does nutrition, or they bring someone in to do a class or something like that. So the kids are getting more, I mean, no disrespect. The
Right.
veterinary students are getting more education now than we did a long time ago. So it's going in the right direction.
But I don't know if that's true, because I went to the student chapter of the AVMA SAVMA conference the last 2 years, and all the students I talked to, they're like, you know, it's not a core competency. It's
Right.
not, you know, we might get 1 or 2 lectures about cats and dogs. It's more feedlot. And so I don't feel like it's come as far as it should, unfortunately.
I agree. And again, I'm going to bring up Peter Attia. He says that in the medical schools, they learn nothing in nutrition.
Yeah.
Right. So they learn drugs,
In
lots of
human
drugs,
medicine.
in human medicine.
Yeah.
Right.
Yeah. And not preventative care.
Right.
So it's up to us to educate. And
Yes.
that's what I tell my clients all the time. You know, they'll ask me questions on whatever, and I'll say, and that's why I teach, right? Because I've learned this over the years from experience. Can I throw one other thing in there? And as a tech, you'll understand this. Right now, they're saying the average veterinary lifespan, work span, is 5 years, and technicians are 7 years.
Wow.
Burning out.
So you're not even getting the 10, 20, 30, 40 years of experience
Yeah.
there. The people are giving up, which is really sad.
Do you think that is that because they're seeing the same issues over and over again and it gets boring, or burning out because they don't know how to address these diseases?
I think there's a lot of issues. I think, you know, and I'm the wrong one to ask, right? Because I've been doing this since 92 and I love what I do. People ask me when I'll retire, and I say the day before I die. Otherwise, right? I think there's a lot of stress. I think there's a lot of social media issues, right? There's the whole, that part of it. How much do you tell, right? The vet schools are significantly increasing the number of students. And then you question how much infrastructure is changing, right? Not as much as maybe it should. We've got 12 new vet schools that are going to be that are coming in within the next decade. They're all applying for accreditation. So we're going to have more schools. We're going to have more students. But you still need the experience.
Yeah.
That's a tough one.
It is. It really is. And that's why I teach.
Yeah. Well, and I think if the more that we can give the information on health span, the more satisfying that job's going to be for them.
Yes.
And that's why when I, talk to them about feeding real food, it's just trying to break through that barrier of, they've been so indoctrinated into kibble. It's really, really hard. And I think they're scared to try something new.
I think it's becoming in human medicine as well as animal medicine. The pet parent, right, as an advocate for their patient. Yeah. And I tell my clients, never believe 100% of what I say, because we practice medicine. Right. My rule is I am a small part of the team. You are the head leader of the team. As your pet's advocate, I will gather as much information as you can from everyone you can, and then make an educated decision the same way you would for your child. And that means if you have something and you don't like it, right, or it doesn't feel right in your heart or your gut, get another opinion. Right.
Absolutely.
Yep. And that's the best that we can do. And it's very, very much like people don't understand consumer buying power. The more you ask for something or require it, those that are providing those services are going to have to eventually learn how to better support you. Yeah. Speak up when you, and I really do believe that about when something doesn't feel right in your gut, ask somebody else, go elsewhere. So that's really great advice. Great advice, Dr. Laurie. We're almost out of time here. Again, if you guys have any questions about fascia, please feel free to drop them in the comments so we can get to them. I do want to remind everyone for our Feed Real Summit this October, workshops are first come, first serve. So Dr. Laurie is going to be teaching our workshop using tuning forks, which is going to be so cool. This is one of our 3 interactive workshops. Kay's teaching our other workshop on how to feed fresh food on a budget. And Dr. Linda Loudon is going to have a workshop on emergency preparedness at home. But these 3 workshops run concurrently. So if you want to join in on any of these workshops, especially Dr. Laurie's, you got to have a ticket first so that you can choose which workshop you're going to be attending. First come, first serve. The summit is October 11th, 12th here in sunny San Diego. And if you head over to the site, we do have a new option now to get your tickets on a payment plan. So if you're looking at, wow, October is kind of far away, I don't want to pay for all of this up front, do the payment plan so at least you can secure your spot in Dr. Laurie's workshop.
Nice.
Hey, did you have any questions that I might have missed? I totally was like,
well, the one thing I was thinking of is this linked at all to loosening the lymphatic system too? Because because I've heard a lot about releasing your lymphatic system, but it's kind of the same along those same pressure points, right?
It is
you can use that too.
Tuning fork. So 75% of your lymph comes through your thoracic duct, which is on your left side.
Yeah.
So before you were born, everything is 50-50. And the minute you're born, a whole bunch of ducts close up. So 75% comes on the left side, and then the right side is only the right half of your head, your right arm, and your right chest. And think about if you have a hose, if you have the nozzle on the end, it doesn't matter how much fluid is behind it, it can't come out. So you can get rid of the swelling.
Right.
So by clearing the lymphatics, the thoracic duct and the terminal duct, and then working on the lymph nodes, you can clear. So do we have time to tell a quick story?
Yeah,
we do.
Okay. So I learned about the tuning fork from Patrice Corticus, who's amazing. She's up in Eugene, Oregon. And I had broken my fibula. We talked about that. And my ankle was swollen. And I'm a rehab vet. So I was doing laser, PEMF, massage, CO2 therapy, and the swelling was huge. And my physical therapist said, it'll take a year to a year and a half to go away. 3 months into it, I go to this course, and Patrice says, I'll work on you with the tuning fork. And in 72 hours, 80% of the fluid will be gone. And 3 weeks later, the rest of it will be gone because we got to clear your lymphatics. And she was spot on. And I said, oh my God, this is amazing. This is what I learned, right? I got rid of the swelling. And now I teach my clients how with the tuning fork to clear the thoracic and terminal duct, clear the lymph nodes, and the swelling goes away.
And that's the same for dogs, that 75-25?
Yep.
Interesting. Yep. That's really interesting.
And we can do things like use a tuning fork to clear the diaphragm so they can breathe better, right? So that they can be more active. So our athletes have better times because they can more lung capacity so that, it just, the whole body works better.
Wow.
Oh, can I give you that tip? If you want to help with your lymphatics, when you take a deep breath, do it with me. And you hold it. What you're doing is you're creating negative pressure. Okay, you can release it. I don't want you to you create negative pressure, and that pulls that icky, sticky stuff out of your thoracic duct and your terminal duct. So people who go running and stuff like that are going to have better lymphatics because if they're busy, right, or working out, that is going to help with the lymphatics. There's so much to teach.
Yeah, so it's all connected there, and so exciting.
Very cool. We did have a question from Camila Hernandez. How is the veterinary world evolving in its understanding of fascia and the use of tuning forks compared to human medicine?
That is a great question. So I am doing everything I can. Every time, like I was just at the conference where I was talking to human PTs, and I'm telling them, like, my brother-in-law had I never remember the name, a disease where you have scar tissue on your tendons and your fingers curl.
Oh yeah.
My sister has that. Yeah.
Yes. Okay. So I was with him at Christmas and he's like, can the tuning fork help this? And I'm like, yeah, we use, actually, see, this is why I brought the lapis. I'll show you guys the lapis lazuli versus amethyst.
Oh, wow.
So this one's wonderful and is best for soft tissue. The lapis is best for scar tissue. And I'm like, let's try it. And I swear to God, within 4 days of him doing this, because he was just hanging out like, this is really cool. It's going down. Not only did he have, and like his physical therapist was like, we can do surgery or we can inject collagenase into that scar tissue, but it'll come back in 6 to 18 months.
Mm-hmm.
He had full extension and you could barely feel the scar tissue.
That's
so
amazing.
I'm doing everything I can to teach as many people as I can. And like, I was just talking to someone who works at NASA and I'm like, you guys have money and you guys have really smart people. Is there a way that we can figure out how to do some kind of research project to prove to people what this thing can do? It's truly amazing. So how is the veterinary world evolving? It is me teaching. And as much as I'm back on the lecture circuit because this is so cool and we want as many people as can know about it.
Yeah.
To start working with dogs and humans. And I can tell you every single one of the people who I have worked with is using it on themselves as well as their dog.
Of course.
I bet. And at the workshop at the Feed Real Summit, we're not going to be able to have 70 dogs in each of our workshops. So we're going to be able to basically practice on each other.
Yes.
Right?
Yeah.
Awesome.
And
sorry, Jane asked if you can ship tuning forks internationally.
I can't, but if you buy the course, so let me explain that. And thank you, Jay. This is a great introduction to this. In the tuning fork course, you can buy really cheap, really bad tuning forks that will not work. Right? I tried one. I'm like, let me try this really cheap one. It was not good. So I bought a lot of really good ones, and I get them literally by the 100, and I get them with the amethyst tip so that people can use it. Because I never want anyone to say Laurie taught me wrong or this didn't work. So when you buy the tuning into your dog course, you get a really good tuning fork with the amethyst tip. And I know one of the first people I shipped one to was Canada, and it was $50 to ship it. So, and we include shipping in the price of the course, right? So people are like, well, I'm in England, I'm in Poland, and I'm like, with that and the tariffs, and it's just really scary for me. But for Jane, if you know someone in the States, and you bought the course, I am super happy to send them the tuning fork. Just email us, support@optimumpetvitality.com, and we will ship it to your friend, and they can ship it to you.
And they'll have to visit you wherever you are.
Yeah.
On that, Dr. Laurie has generously offered all of our students and everyone tuning in 10% off of her courses on optimumpetvitality.com. If you use the code FeedReal, all uppercase, one word, you are going to get 10% off of that course. That is awesome, Dr. Laurie. Thank you for offering that. And I think it's to have the tuning fork included with the course is like, it's a no-brainer because they're going to want to practice what they're learning immediately.
Yeah.
Very, very cool.
Yep.
I just have to ask, the amethyst tip versus what was the other one?
Lapis. So there's actually, we have 8 different tips, and they all do different things. So like citrine helps more with GI issues, rose quartz for circulation and heart. It comes with amethyst because it's a fascia course, and this is the best one for soft tissue. The lapis is best for scar tissue. And when I first heard this, I'm like, I'm a scientist. I'm like, yeah, right.
Yeah.
And then Sid had emergency abdominal surgery. We thought he had a foreign body, and thank God he didn't. But his incision got infected. I was in and out of town, and he had literally like 4 millimeter thick scar tissue. And I was devastated. Like he's okay. So can I brag for a second? He is one of very few dogs in the world that can walk on a round ball. And he walks sideways, forwards and backwards, spin, twirl. He can do 60 to 80 beg, stand, beg, which is very hard for most dogs to do 1 or 2 of. He couldn't do sit up and beg because of scar tissue. And I was like, oh my God, what do I do? And I'm like, okay, we'll try the tuning fork and it's helping. And then I'm like, wait, lapis is supposed to be for scar tissue. And I grabbed my lapis tip and I was like, in 8 minutes, he was able to do his bag stand bangs again.
What?
And I'm like, okay, so let me see this. So I stimulate the tuning fork and I put it on me. And then I take the one with the lapis and I put it on me. And I'm like, oh my God, it feels totally different. Tuning fork is exactly the same. You get a little Allen wrench and you can change the screw and take the tip off and put other tips on.
That's what I wondered. Okay.
And then I had a vet friend of mine who I work with when I go down and work at LSU, the vet school, said, Laurie, I'm a Stony. Of course they have different effects with the vibration coming
Different
through.
vibration.
They
Yeah.
have different hardness. They're, is it made of calcium? They have different components.
Yeah.
Vibration coming through it is going to have a different effect.
That's so
And
amazing.
I have a client who does tuning fork work for humans, and she does it in the bio field, right? Whereas I do it on the tissue. Okay, you work on me, I work on you, we teach each other, right? We always want to learn. And she came to me and I went to work on her and she's like, yeah, I'm having these stomach issues. And I'm like, okay, citrine is good for GI issues. Within like 3 or 4 minutes of working on her abdomen, you hear gurgle, 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 gurgle. She's like, oh my God, this is amazing. So it's
fascinating.
Super cool.
That is
awesome. Thank you. Thank you for sharing that and all the tips that you shared today. We are really, really excited for you to come to San Diego. And I hope everyone on our live enjoyed a lot, bits and pieces of this information. Really, I mean, there's so much to cover, so I can see how valuable your courses are.
Yeah. So excited.
Fun.
Thank you again. Thank you all for joining us today. Hope you have a good rest of your Thursday and a wonderful weekend. And we will catch you next time.
Thank you.
Bye.